Dear folks, welcome. Did you know that India is deemed to be the diabetic capital of the world? It is close to hitting the alarming mark of 80 million by the year 2030. So I think it's very important for all of you out there to know what is diabetes, the types of diabetes, the symptoms of diabetes, the complications, the diagnosis and the treatment of diabetes. So I'm Dr. Neeta, an obstetrician and gynecologist, and welcome to Dr. Neeta's Medical Clinic. At the outset, I would like to request each one of you to please view the entire video, like the video, comment on it, and then click on the subscribe button, and then on the bell icon, and then all. Subscription is absolutely free, folks, and if you do this whenever I upload a video, you will get an instant notification. Now, without any further ado, let's delve into the video. Okay, this is going to be a slightly long video, so please do watch patiently. Now, blood sugar shooting through the roof. What does this mean? This means that you have something called diabetes. Do you need to panic? No, just cool down, because with the right guidance, you can definitely control your blood sugar levels and lead a very good life. Now, what exactly is diabetes? Diabetes, in short, is a metabolic disorder where there is high blood sugar level, that is called hyperglycemia, and that is a result of lack of insulin, insufficient insulin, or insulin resistance in the body. And what is insulin? Insulin is a hormone which is produced by an organ called the pancreas in our body. Now, what does this insulin do? The insulin helps in keeping our blood sugar under control. Now, usually diabetes is a hereditary problem and it is passed on from generation to generation, but it can occur to anybody at any point in their life. Previously, it was considered an old man's disease, but nowadays, with the advent of fast food and lack of exercise, we see it in younger and younger age groups. What are the types of diabetes? Diabetes is of three types. Now, type 1 diabetes, it is mostly found in children. Here, there is little or no insulin produced by the pancreas, and so insulin injections have to be taken for a lifetime. Then we have type 2 diabetes, which is also called adult onset diabetes, usually found in adults, and this is usually due to insufficient insulin or insulin resistance in the body. Then we have gestational diabetes, where diabetes is encountered in a pregnant woman. Now, pregnant women have a lot of changes in their body and sometimes they'll end up with diabetes. The most common type is type 2 diabetes or adult onset diabetes, and I will be talking about it today in detail in this video. First, let me burst a myth. Diabetes is definitely cannot be permanently cured, and so do not fall prey to those ads which claim that diabetes can be cured. It cannot be cured, it can only be controlled, and you can control it in a very good way so that you can lead a very long and healthy life without compromising on the quality of your life. And you require the right kind of diet, you require the right kind of exercise, and if necessary, you have to take oral anti-diabetic drugs or even insulin. So let me tell you today about this silent killer called diabetes, adult onset diabetes in particular. Sometimes, again, with the help of the right kind of exercise and diet, diabetes can even go into remission. Now, how will you know that you have diabetes? What are the symptoms of diabetes? Now, first of all, diabetes may be absolutely asymptomatic. That means even if your blood sugar is very high, you may have no symptoms. So, it is definitely better that you check your blood sugar every once in a while, and especially if you have family history of diabetes, you should check it more regularly. The second symptom may be polyphagia, where you will be very hungry all the time and you will eat lots of food. The third would be polyuria, where you will have frequency of urination will increase, you will have to pass urine repeatedly. And fourth may be polydipsia, where you will have lot of thirst. You may have blurred vision if eyes are affected by diabetes. You can also have fatigue if the blood sugar is very high. You can have numbness or tingling in the feet. You can have repeated infections like repeated urinary tract infections or repeated vaginal infections. Also, accidentally, if you cut yourself, you may also have very slow wound healing. Now, if any of these symptoms are showing up in you, if you're faced with any of these symptoms, then please do directly approach a doctor. Now, who is at risk for diabetes or who can get diabetes? Now practically anybody can get diabetes, but the more at risk population are one who are overweight or obese, second those who have a family history of diabetes, third who are pre-diabetic, fourth who have gestational diabetes, that is during pregnancy they had diabetes, so they have a greater chance of contracting diabetes later on in their life. And then we have PCOD problem people whose PCOD is an ovarian problem, but these people in the long run they may develop diabetes. Then also sedentary lifestyle, that is if your lifestyle doesn't involve a lot of physical activity, you can end up with diabetes. And if your age is greater than 45, you can land up with diabetes. Now when you approach a doctor, the doctor will advise you a lot of blood tests, but the most important would be a fasting blood sugar, a postprandial blood sugar, that is blood sugar after eating, and HbA1c level. Now what should the fasting blood sugar be? The fasting blood sugar should ideally be less than 100, and that is considered normal. Previously we used to take it less than 110 as normal, but nowadays less than 100 is normal. How much fasting is required? At least fasting of 8 to 10 hours is required. Now if your fasting, as I told you, if your fasting blood sugar is less than 100, it is normal. If it is between 100 and 125, then it is considered pre-diabetic, and if it is more than 126 mg/%, then it is considered diabetic. Also, your postprandial blood sugar, that is blood sugar after lunch, should be measured from the time you have started your lunch. So 2 hours from the time you have started your lunch, and then you measure your blood sugar level, and ideally this blood sugar level should be below 140 mg/%. If your post-lunch blood sugar is between 140 to 199 mg/%, then it is suggestive of diabetes, but it requires more tests. And if your blood sugar is more than 200, then you definitely have diabetes. Even if you take a random blood sugar sample and you test it, and if your blood sugar comes more than 200 mg/%, then you definitely have diabetes. Now what should your HbA1c level be? Ideally your HbA1c levels should be less than 5.7%. If it is less than 5.7%, it is normal. If it is in between 5.7 to 6.4%, means you have pre-diabetes, and if it is more than 6.5%, then you have diabetes. Now what is pre-diabetes? Pre-diabetes is a condition where it is a condition before diabetes, and if you don't take care, you will develop diabetes. And people who have pre-diabetes are at risk for developing diabetes. How will you check whether you have pre-diabetes? There is a test called oral glucose tolerance test. Now in this test, you will be given a solution containing glucose to drink, and the blood sugar level will be measured at regular intervals. If the test is normal, that means you are not a pre-diabetic. If the test reports are abnormal, then it may suggest that you are a pre-diabetic, and if the blood sugar levels are alarmingly high, then obviously it suggests diabetes. So this can be done if you are at risk for developing diabetes. Now how to measure blood sugar at home? Now I think those who have diabetes should ideally have a glucometer at home to measure your blood sugar at home. Now how will you do this? First, wash your hands thoroughly with soap and water, and then you will have this glucometer. Now this glucometer, you will put this strip which is given to you. Now this strip has an arrow here, so you will put the arrow mark. You will insert it with the arrow mark showing, and then it will go inside like this, and then it will start showing a blood drop. When it starts showing a blood drop, then you have to prick your middle finger or your index finger. You will have to give a prick with the needle, and when the blood comes out from there, a drop, you will just gently touch this yellow, I hope you can appreciate that yellow bar down there, so that you will touch to the drop. So this whole yellow bar will be covered with blood, and then you will take it off. And once you take it off, within a few minutes you will get your blood sugar recording here. So this is a very important thing to have at home. So in case you have diabetes, please get one from a reputed company. As soon as this test is over, please take a cotton and give pressure on the finger so that the bleeding stops within a few minutes. Now ideally, the middle finger or the index finger should be used. Do not use the little finger because the skin is very thin there. What are the complications of diabetes? Now diabetes is such an illness that if you know the right way to go about it and take the right precautions, most of the complications can be avoided. But if you do not take care, then you can land up with a lot of complications. Now, what are the complications? Diabetes can affect all organs of the body. It can lead to Alzheimer's, where there is loss of memory. It can lead to stroke. It can also lead to depression. Decreased blood flow to the heart can lead to a heart attack. If diabetes affects the kidneys, eventually they may lead to kidney failure. Repeated urinary tract infections, repeated vaginal infections, again repeated infections anywhere in the body. Even incontinence of urine can occur if diabetes affects the bladder nerves. Nerve damage can lead to tingling, numbness, burning sensation, and sometimes if the nerve damage in the legs is combined with infection, it may lead to amputation of the limb. Sexual dysfunction in both males and females can occur because of high blood sugar levels. Blindness can also ensue if blood sugar levels are very high and uncontrolled. Finally, diabetic coma. Now, diabetic coma is of two types. One where the blood sugar is very high, which is called hyperglycemic coma, and the second where the blood sugar falls and becomes very low, that is hypoglycemic coma. Now, in hyperglycemic coma, the blood sugar is very high and you fall unconscious. Now, this coma can be reversed if treated immediately. If it is not treated immediately, then it can also lead to death. Now, even hypoglycemic coma. Now, hypoglycemic coma is where the blood sugar falls below 70 mg/% and the symptoms would be lot of anxiety, a sinking feeling, there would be sweating, dizziness, confusion, and lot of hunger. This hypoglycemic coma usually occurs if you have taken insulin or oral anti-diabetic drugs and have not eaten properly. So my dear people, do realize that if you are diabetes, you can go into hypoglycemia, and so I would advise you to carry a small dabba of sugar everywhere wherever you go. And if you feel the symptoms of hypoglycemia, immediately put some sugar under your tongue. So that will lead to absorption of sugar and your blood sugar levels will be corrected. And if you feel symptoms of hypoglycemia, you may also drink a sugary drink like maaza or fruity, and that also would help in alleviating your symptoms. Hypoglycemic coma again is reversible if treated immediately. If not, again this could lead to death. Now, how to prevent a hypoglycemic coma? I would advise you that before consuming any anti-diabetic drugs or insulin, always make sure that there is food ready in front of you and you are 100% sure that you are going to eat that food. Without this, do not take any oral anti-diabetics or insulin. Now dears, the idea was not to lead to panic about diabetes. These complications which I enumerated to you can definitely be prevented, and you have to take the right precautions, you have to eat the right kind of food, and you have to exercise, and you have to take proper guidance of the doctor to avoid all these complications. And if you do all this, you can be ensured of leading a very good quality life. Now, what lifestyle changes should be made in diabetes? Now, in diabetes, physical exercise is a very important part of the treatment, and if you are obese, you need to lose weight. The moment you lose weight, then your insulin starts behaving properly and it starts correcting the blood sugar level. You can join a gym, but make sure that you go to the gym daily, because if you just pay money and don't go, it's going to be a waste. You can do cycling, yoga, swimming, all these are good exercises. But if you can't do any of the above, then the best is walking. Walk at least 45 minutes a day and 15 minutes of light stretching exercises. Now, walking advantage is that you can even walk at home. You don't need to go outside, you don't need special clothes. You can walk at home, and 45 minutes you can walk, and 15 minutes of light stretching exercises should maintain your blood sugar level along with the right kind of food. 1 hour of exercise per day should be enough to keep you fit. Just put some music into your ears and walk. You will not even realize how time passes once you listen to the music. If you drink alcohol, then drink in moderation. If you're smoking, try to quit smoking, as the nicotine levels will increase your need of insulin. Now we come to diet in diabetes. Ideally, if you are a diabetic, then you should approach a doctor who will prepare a diet chart for you and will also guide you regarding exercises depending on your age, your sex, your weight, etc. But I'll be giving you a few pointers here as to what to avoid specifically in diabetes. Now in diabetics, you have to avoid high glycemic food. What is high glycemic food? High glycemic food is food which when you eat instantly increases your blood sugar levels rapidly. So these kinds of food you need to avoid. And what are these kinds of food? Food like sugar, jaggery, honey, then white and whole wheat bread, white rice, breakfast cereals and cereal bars, cakes, pastries, cookies, ice creams, cold drinks, sugary juices, butter, ghee, chocolates, mithai, dates, raisin, cream biscuits and gluco biscuits. All these you have to avoid. And also in case of fruits, you have to avoid fruits like sitafal, mango, grapes, chiku. Especially stay away from oily food like chips. What can you eat in diabetes? Again, it is best to go to a doctor and get a diet chart made especially for you, because every person's calorie requirement is going to differ. But what can you eat? I'll be giving you a few pointers. A well balanced diet is necessary. Drink plenty of water. How much water to drink? You should drink as much water so that your urine should be colorless. 4 to 5 light meals per day is any day better than having heavy meal at any time. Always eat in moderation. Never eat in excess any kind of food. Sugar-free tablets and sachet are okay, but again do not overuse them. And sugar-free tablets are to be avoided in pregnancy. In the market you will get plenty of sugar-free foods. Now this sugar-free foods, again you have to eat in moderation. Do not overeat. Ideally in diabetics you are not supposed to overeat at any time, any point of time. And non-vegetarians, fish like salmon is a good option. Again fried fish is not done, not to be eaten. Boiled eggs are good. And you can have chicken. Again chicken should be prepared in a low calorie way. Do not use any high calorie substances to prepare the chicken. Then in case of vegetarians, you have green leafy vegetables which are highly nutritious but low in calories. Then you have vegetables like broccoli and sprouts. Then beans. Again beans are low glycemic index, highly nutritious. They do not elevate your blood sugar levels to a large extent. Salads. Raw salads are better. Again salad dressing, do not do it with high calorie substances. Basically raw veggies, roasted veggies are a good choice. Then in case of fruits, you can go for oranges, you can go for apples, melons, strawberries, cranberries. All these will help in maintaining blood sugar levels. Yogurts are okay, but again go for yogurts which have a high protein level and low carbohydrate level. You can have a handful of nuts like walnuts, almonds, pistachios and hazelnuts. Apple cider vinegar has beneficial effects on blood sugar. Now how will you treat diabetes? Now basically diabetes is a chronic disease and it is going to remain lifetime with you. So you have to choose a diet and you have to ask your doctor to give you such a diet which you can follow for your lifetime. So with the right kind of diet, the right kind of physical exercise, oral anti-diabetic drugs or even insulin, and taking adequate precautions, and at the slightest sign of trouble going to the doctor. These are all the treatment which we would recommend for diabetes, and with this you are sure to lead a very long, healthy, uncomplicated diabetic life. So my dear friends, this is it for now. I plan to make a follow-up video on diabetes sometime, as there is lots more to be said. If you have not subscribed as yet, a gentle reminder to please subscribe. This will mean a lot to me. So my dear friends, till we meet for the next video, have a very good healthy life and maintain your blood sugar levels. So bye bye dears.